Welcome to today's video, where we will be discussing the differences between EEG and MRI machines for autistic children. Both of these diagnostic tools are used in the medical field to detect neurological abnormalities in patients, but they differ in their approach and the information they provide. In this video, we will be exploring these differences in detail and help you understand which method is best suited for the diagnosis of autism in children. So, let's get started. EEG and MRI machines are two popular diagnostic tools used in the medical field to detect neurological abnormalities in patients. Both techniques are used to diagnose autism in children, but they differ in their approach and the information they provide. Electroencephalography. EEG measures the electrical activity of the brain, while magnetic resonance imaging, MRI, provides a detailed image of the brain structure. Let's take a closer look at these two methods and compare them in detail. EEG measures the electrical activity of the brain by placing electrodes on the scalp. The electrodes record the electrical activity of the brain and create a visual representation of the brain's electrical activity. This process is non-invasive and painless, and can be performed on children as young as a few months old. The process is also relatively quick, taking only about 20-30 minutes to complete. MRI, on the other hand, uses a large machine to create detailed images of the brain structure. The patient lies down on a table that is inserted into the machine. The machine then uses a magnetic field and radio waves to create detailed images of the brain. The process can take up to an hour or more to complete, and requires the patient to remain still during the procedure. This can be difficult for some children, especially those with autism who may have difficulty remaining still or who are sensitive to loud noises. EEG provides information about the electrical activity of the brain. This information can be used to detect abnormal brain activity, such as seizures or other neurological disorders. In the case of autism, EEG can be used to detect abnormal brain waves or patterns that may indicate a neurological issue. MRI, on the other hand, provides a detailed image of the brain structure. This information can be used to detect abnormalities in the brain structure, such as a tumor or other physical abnormalities. In the case of autism, MRI can be used to detect differences in brain structure or size that may indicate a neurological issue. EEG is generally less expensive than MRI. This is because EEG machines are smaller and less expensive to maintain than MRI machines. EEG also requires less time for the procedure, which can reduce the overall cost of the procedure. MRI, on the other hand, is more expensive than EEG. This is because MRI machines are large and expensive to maintain. The procedure also takes longer to complete, which can increase the overall cost of the procedure. EEG is a non-invasive and painless procedure, making it safe for use on children of all ages. The electrodes used in the procedure are placed on the scalp and do not penetrate the skin. MRI, on the other hand, is a more invasive procedure that requires the patient to lie still inside a large machine. The procedure is safe for use on children, but can be uncomfortable or frightening for some children, especially those with autism who may be sensitive to loud noises or have difficulty remaining still. When deciding which method to use for the diagnosis of autism in children, it's important to consider the specific needs of the child and the information that is needed. If a quick and non-invasive procedure is preferred, EEG may be the best option. If detailed information about the brain structure is needed, MRI may be the best option. Ultimately, the decision should be made in consultation with a medical professional who can help determine which method is best suited for the child's specific needs. We hope this video has helped you understand the differences between EEG and MRI machines for autistic children. Thank you for watching, and we'll see you in the next video.